I think if there were a overarching theme to what gets me excited about this stuff, it's the idea that I think we all deserve, because we're all patients at some point, we have family members that are patients, is to feel like we're going to get the right treatment at the right time. And sometimes that's no treatment. Sometimes that's a big treatment. Sometimes something in the middle. Sometimes it's a fusion. Sometimes it's a motion preserving device. Sometimes it's not surgery at all. And, the kind of work that we're talking about right now, when I first started doing it, I was like, honestly, I was thinking to myself, okay, so if I can help a hospital improve their profit margin because we're doing the same surgery less expensively, I guess that's great. But that doesn't really get you up in the morning,
Yeah.
Okay, sure. What if I own the hospital or I owned a surgery center? Yeah, then there's that's more money in my wallet. Okay, that's great. But is that really what this is all about? And that's when I realized that the more you can zoom out on this sort of outcomes and cost tracking, the more powerful it becomes. And that's where I think there can be a real contribution. And things like motion preservation actually get highlighted. So let's say, instead of just saying we want to reduce costs for ACDFs, you made the point about condition-based thinking. Let's say, and this is going to happen, because right now, it's like a primer, people talk about bundled payments, and the definition of a bundled payment is whether it's an employer or the government or Blue Cross, they come and say, all right, T-lifts, 1 level lumbar fusion, this is your lump sum payment to the hospital, to a practice. It's up to you to decide how to divvy up your dollars and execute this care for this T-lift procedure. If your costs exceed that predetermined lump sum payment that we gave you, you're going to lose money, tough luck. If you come under, you keep a piece of that savings, right? That's the idea behind the bundled payment. What it does is it reduces waste within the care episode because it forces all the stakeholders to get lean. So maybe we should use that less expensive implant, but it doesn't necessarily reduce over-utilization of unnecessary procedures, right? You still want more bundles. You still want to do more T-lifts. You just want to do it in the least expensive way. And the stakeholders have realized this. So what's coming now is condition-based bundle payments, not procedure-based bundle payments, where they're going to say, okay, lumbar stenosis or lumbar spondylolisthesis, when you have a slipped vertebra and you have nerve pinching associated with it, here's your lump sum payment for that. You figure out how to make that work, whether it's physical therapy, pain interventions, mental health, opioid weaning, because maybe you just wean the patient off opioids and maybe their pain doesn't get completely gone, but it gets just better enough that they can do whatever they need to do, or surgery. When you get to condition-based bundle payments, suddenly now the foraminotomy looks pretty good compared to the ACDF, as long as the patient gets better.
Yeah.
Right? Because that might be an outpatient procedure that the patient leaves in 2 hours, no implants. And now if you start assessing surgeons or practices on a condition, that ACDF, loving surgeon that does it for every patient, who looks really good to the hospital in the status quo because the DRGs for the fusions are coming in and life is good, versus that surgeon that's like, you know what, when it's the right opportunity, I'm going to do a foraminotomy. Maybe that's 30% of the time for a unilateral radiculopathy, whatever the rate is. That surgeon's going to look really good in a condition-based bundled payment system because they're getting the same outcomes at a much lower cost. And the hospital's going to love him, him or her, the practice is going to love it. And so when that happens, practice patterns, I think, are going to change.